Something is in the air. Sore throats fit no be ordinary sore throat o. Updates don show. Skip this video at your own risk. If your throat is on fire, you are feeling weak, or you just want to sleep, you now say you're under the weather, come and confirm if it's the correct weather. If it is another weather, that regular sore throat can block your breathing, damage your heart, and even, you understand? It is diphtheria, and trust me, they know they use a joke. Diphtheria is a bacterial infection. It's highly contagious and it affects the throat and sometimes the skin. They used to catch it the same way they used to catch cold or flu, through cough, sneezing, or even touching infected surfaces. But unlike flu, diphtheria is way more dangerous because it produces a toxin that can attack your heart and attack your nervous system. You get it? And without treatment, it can be very, very deadly, especially for young children. It is UNICEF that dropped the update too. Your children, look them well. Some of you are risky like this, and it is the risky people that will catch it. If you are not vaccinated or you do not complete your vaccines, risky. When too many people are unvaccinated, especially in places where healthcare is not strong or where people live in overcrowded areas, outbreaks will happen. Children under 5 years old are the most vulnerable, and if they get diphtheria without treatment, the chances of survival drops drastically. But even adults are not safe if they haven't been vaccinated. Let's even understand the symptoms so that you can know what to watch out for. Cause the thing does not start dramatically. It be like thief, it just sneak up on you. So if you notice any of these symptoms 2 to 5 days after exposure, don't ignore them. Number 1, sore throat that feels worse than usual. It no be like the normal one. Number 2, fever, body just dey hot anyhow. Swollen neck glands, you notice that your neck is looking bigger than normal. Cough, weakness and fatigue, you are just feeling drained, you don't know wetin dey occur. The most serious sign is a thick grey coating on the throat. This can make swallowing or even breathing difficult. If diphtheria is left untreated, it can cause heart damage, it can cause nerve problems, and in many cases, death. That's why early treatment is a must. Over to treatment. What do you do if you suspect that you have diphtheria? This is not the time for self-medication. Forget about your herbal tea. Forget about let me just drink warm water and rest. If you or someone you know has any of these symptoms I don't talk now, abeg, carry your slippers, run go hospital immediately. Doctors will treat it with diphtheria antitoxin to stop the poison from spreading. Another way is antibiotics to kill the bacteria and prevent further damage. And another thing that they will do, vaccination after recovery so that they can stop the diphtheria from coming back. You understand? Also, if you've been in close contact with someone who has diphtheria, you should also take antibiotics and make sure you are fully vaccinated. Then as for prevention, you know now, the best cure is not getting it at all. Diphtheria is 100% preventable with vaccination. The vaccine is free at health centers in Nigeria, public health centers, okay? WHO recommends 6 doses starting when a baby is just 6 weeks old. Even as an adult, you may need booster doses for long-term protection. Please, without proper vaccination, diphtheria can come back. And trust me, you don't want it to come back. Go and visit your nearest health center today for your free diphtheria vaccination. Also, I'd not tell you, and share to somebody so that people can know that something is in the air and everybody can get protected.